Hello, everyone. Today it is my pleasure to welcome my friend, Dr. Mashiul Chowdhury. I call him Mash because he's one of my closest friends in the United States. For the last 7 years, we have had many lunches together. And because of this COVID, we have been separated. So I couldn't be any more separated from him. And I urge him to come and join me for this candid discussion. You will enjoy his talk. So, Mash, welcome to my channel and thank you for taking the time. How are you?
Oh, Farhan, it's a pleasure and great seeing you. And it's a very interesting moment that we are here, but we are meeting in a Zoom. But, it's very innovative ideas of what you're doing, bringing everybody together in the time of social distancing. So it's one way we are distancing, but other way we are actually getting very, very
Yeah,
close.
and as I think it would connect us even deeper at a deeper level. And you are such an inspiring person, thoughtful person, that I want to share your story with my friends, my extended circle, so that I think many people will pick an inspiration from your thoughtful words. And so let's dive deep into a little bit of your life. So take us back into your young age of when you were finishing high school, and how did you decide to become a doctor then?
Oh, thank you so much, Farhan, again, for your kind words. And thank you again for having me. And I would like to share my stories with your audiences. So I grew up in Bangladesh, and many of you know that Bangladesh is an independent country. We are together before 1972,
Yes,
and then
true.
and then we got independence. Uh, but we are still brothers and sisters. So I grew up in Bangladesh, and in a middle class family. So my father was actually a college teacher, and his focus to bring all of our siblings to a level of education where we can actually live independently, survive with their respect and everything. So that was, I think, every parent's dream for their kids. My father was a very curious person, and he was, very dynamic person. So he not only was teaching in his college, he had an interest in art, drawing, and trying some homeopathic medicine. And he used to bring all his, the little box with all these little tubes, the glass tubes with the homeopathic medicine. So I was the only one among our siblings was very curious and interested in handling his boxes actually.
Oh, really?
So yeah, so my mom was looking at me and found that yeah, I probably have interest in medicine, and she kept telling everyone and telling me, well, my son probably is going to be a doctor.
Oh,
And on
wow.
the other hand, my older brother, he was interested in like some wearing, fixing things. So my mom already set up our goal actually that, this guy is going to be a doctor and his brother is going to be engineer. And it turned out to be very interesting that, yeah, that's what happened
That's
exactly.
what happened. Okay.
Yeah, and as you know that there's this stereotype in our culture that if you have a kids who are sort of good boy and studies all the time, they dream them to be a doctor or engineer, and it's of course it is a very prestigious profession and noble profession. So I don't have any regret of going to medical school and enjoyed a lot. So I became a physician and practiced a little bit in Bangladesh. Got an opportunity to come to US back in 1989, and my actually life started in the lab. So my mentor, Dr. Khalili, he actually was a very known neurobiologist. He was very much interested in hiring someone who can actually work in his lab, doing a research on HIV virus and JC virus. At that time, HIV was just diagnosed to be a, very significant disease, AIDS, and very preliminary work started. So I joined their lab and the team to a research on a disease called progressive multifocal encephalopathy, PML.
EML,
And
yeah.
yeah, I mean, to be honest with you, before I joined the lab, I really didn't have any idea about how to do this, studies on basic biochemistry like DNA, RNA, and all these translation, transcription. Those are like a hypothetical for me. I mean, just reading the book, but someone can study this and understand this in the lab. That was a fascinating experience for me. It was very challenging in the beginning, of course, but I worked very, very hard. I produced a lot of, top quality journals and articles on those. And some of the pioneer work on PML was done in our lab, and I was really the first author on those things. So, feel very proud about it, doing this. And then subsequently, studied USMLE and got into clinical.
So, Mash, thank you for sharing that inspiring start, a humbling start of your life as well as inspiring. So, you went to Dhaka Medical College, and at that time, how how were people thinking to come to America at that time? Were your friends not going to England? Because when I grew up, most of my family went to England if they were. How did you come about America?
Yeah, very good question, actually. I was in a transition. So, a few years after I came to USA, everything became global, and internet and social media and everything. So, it's interesting that when I was in Bangladesh, we didn't have much idea about, US culture and science and everything.
Yeah.
People are not really looking forward to come to USA and doing USMLE, which became a trend actually just few years after I came here. So I didn't have much idea about coming to US and doing a clinical practice here. Most people, you're absolutely right. Most people who can afford going to England and doing the MRCP and FRCS, those type of thing actually, and come back to Bangladesh and practice.
Yeah.
But US was just kind of a starting point at that time.
Very interesting. You landed in Philadelphia, the city of brotherly love, and you have never left. Is that true? Right?
Yeah, absolutely. One way you can say that pretty boring, but uh, I feel that I'm really, really lucky because I came here and I never ever, even a day, thinking of leaving this city. It is a city of brotherly love for me. Yeah, absolutely. Um, it is a very, very vibrant. It is down to our city, and it's not like a expensive New York or Washington D.C. So I kind of see that Philadelphia is in the middle.
I know that, and through your friendship, I have started to actually love and like Philadelphia myself. I, as you know, I was in New York City, so you have given me a lot information and things to love about Philadelphia, and we'll get into a little bit more fun stuff that we
Mm-hmm.
have done together. It seems like that your life journey to become an infection disease doctor was in your fate because you landed up in a lab that was in PML, JC virus. What do you think about that? How was that came into be? You could have landed up in some other lab and would have turned out to be something else. Was there something else in
Absolutely.
it that brought infection disease in your career?
Yeah, absolutely. I mean, that's a very good question, actually. You could say that, well, did I really plan that way from the beginning? No, absolutely not. It actually came in an opportunity, and I took that opportunity and always try to take that to another level.
Yeah,
So, when I was in medical school, one of the subject that parasitology,
yeah.
and most people hated that because it is so complex life cycle of organisms and the parasites. But somehow I had a fascination of studying them and remembering all this weird name actually. You know, Washiria, Fun Crafty. I mean, how on earth, you know, I can remember all this very peculiar, weird name. But I was very good in it. So then I came to this lab, and for years actually, I thought cellular biology and the virology was so fascinating that I thought I would make my career in that research area
Research
and
area.
forget about clinical. But you know, more I did and started working, the lab research is something which actually not, you know, actually is your intellectual and smartness, but also you need some kind of connections with, you know, uh, top people to get grants and funds, which is not very fun actually. So
Yeah,
the reality was surviving in a lab and research is very pretty tough job.
I
Um,
agree.
yeah, so you know, I thought that you know I would
Wow.
try my clinical.
And I think that knowing you clinically and understanding you, I think that there is a reason you were there for time. It needed to bring your love for infectious disease, grow that, and then get you into a successful career in infection disease. I mean, right now you are the chief uh, of infectious disease for the enterprise of Cancer Treatment Centers of America, which is an honorable position, and it comes with a lot of responsibility, which you take very seriously. So let me go a little bit into becoming an infection disease physician, kind of after residency makes sense. But then you became a program director for a residency program, a fellowship program. So
For the
tell me a little
fellowship
bit
program.
about that.
So Farhan, when I left my lab and then I wanted to be clinicians. So
Mhm.
the clinical infectious disease and the you know the reason for coming to infectious disease is a little different than my lab experience. So I was fortunate to round with a very highly intellectual and smart infectious disease physician during my residency program, and you know I thought that it is a very cerebral specialty. Not that others are not, but the infectious disease actually doesn't require you to do procedure, which I'm really bad in it. uh, I hardly could do any like subclavian line on those things are putting a polycatheter. But more than that, no, I'm not that kind of person. So I wanted to do something that thinking process, and I think the infectious disease is like a detective work. So if some organism in the blood, you wanted to, you know, see where this is coming from, and it lead to some, you know, the focus of attention and the source of the infection. If you go there, and you can actually and get to the, you know, the granular level, and then treat the patient accordingly. So I became, you know, very much interested doing this work and did my fellowship. So fortunately, because my interest and passion and understanding, I thought that my fellowship training was one of the best experience I had actually. Because I always believe that your profession can take a toll on your life.
Yeah,
And it is a daily activities, it is a cerebral activities, a physical activities. If you don't really have much fascination or passion and understanding of your profession, then life can be very tough and challenging. So fortunately, that's not the case for me. I always feel like, you know, I don't feel an anxious you know, or the stress of coming to work. That is the plus point. When I did my fellowship training, I never felt that, you know, it was a stressful time for me. I love to stay back even after 5 o'clock or 6 o'clock. I love rounding with my attending because I love infectious disease. Sometimes I feel like, you know, well, you know, something that I'm doing is nobody's asking me to do that. I'm doing it for my own interest
for
and
your
grow
own.
from there.
So
So
I think that's one of the unique thing about you is I've learned after talking to you many times. Number one, your way of handling things has told me that number one, you never try to chase money. You never try to do things just because everybody expects you to do. You go by where your heart is, and I think that led you to develop likeness for your profession. And we hear about it a lot. Do what you love to do because your work is
Correct.
not your work. And I think that's what exactly we need to convey to the people, that if you come into medicine, in medicine you can find fields that could help you build lifestyle of your own choice. And that's really good. Now, is there an unforgettable infection that you saw, or an unforgettable case that that you still remember from your rounds of teaching and stuff?
Oh yeah, Farhan. I mean, I remember a lot, but a couple of in the cases that actually will carry with me for or stay with me actually
Yeah.
rather for a long time. Uh, so you're absolutely right, and thank you for saying that again. Yeah, you really have to love your profession. You really have to love your specialty. So when I was a program director, the candidates used to come, and I always ask them the first question. Look, I mean, the infectious disease specialty is probably the lowest paid specialty. Why do
Yeah.
you like that? You have to have a reason for it.
Yeah.
So, unless you love this field, you can't really carry on. It becomes a burden for you. But it never. I mean, I am always, every single day, I'm fascinated by all this new innovation and new viruses and everything. I wish it doesn't happen, but it excites me, of course, as a specialty. So, yeah, there are a lot of cases. One case is actually is very interesting, and it's funny too. Uh, that I had a patient who actually had an arthritis. I think you can relate to that case
Hmm.
because of your specialty of rheumatoid arthritis. So I had a middle-aged female who was admitted with septic arthritis, and she was growing pseudomonas, and it was tapped in orthopedic clinic a couple of times, and every time it was growing pseudomonas aeruginosa, which is in the very low inoculum, very low level.
Hmm.
So that patient was admitted, and I was very curious about the source of this infection, because the pseudomonas infection in the knee doesn't really happen out of nothing.
Yeah.
You really have to have either bacteremic seeding from other sources or trauma or anything like that. So there's no visible trauma, nothing. So I started asking her, that patient, what your occupation, what do you do every day, and things like that, pet history, whether she was IV drug abuse, none of them.
No.
So, but I can see that, I repeatedly asking her questions, she was very defensive, was hiding something. That made me even more interested,
Yeah.
asking her more questions. So I said, look, I mean, you have this serious infection. If you're not telling me all this story, then, it's going to be very tough to treat. So I hope, you can tell me and share so I can go to the source. So eventually she said she was, having a pet at home, and those are iguana, the
Iguana.
reptiles.
Wow.
She had the iguana in her bathroom, and one of them got sick at some point.
Wow.
And that one of the iguanas, she actually took it to vet, and they sacrificed that one. So I called that hospital, and they confirmed me, but they couldn't tell me what kind of infection. So then I became more interested, because I know that the pseudomonas and all this salmonella then can come from reptiles. So I requested the patient to bring the reptile to iguana to our lab, and she did it after
She
she got
did it.
better.
Wow.
Yeah, she did
Wow.
it. So she brought her iguana, and we cultured that iguana's, the oral cavity and the anal area. And guess what? The oral cavity grew exactly the same Pseudomonas aeruginosa
Oh,
that we found in
wow.
her knee. Um, so that was a really great lesson for my students and fellows and everyone. I said, infectious disease is a very detective work.
Yeah.
So you really need to ask the right question to patients so you can go to the source and take care of it. So patient understood where it's coming from and everything. So she eventually, got rid of that and got better.
Wow, that's such an interesting story. Wow,
Yep,
that's that. I mean, animals have and how they can cause infection to humans. Is now a
exactly.
mystery because with the COVID-19,
Yep.
everybody is asking about bat, and I think you shared that story with me how the the wet market you were showing me one day.
Mhm.
Um, so let's dive into a little bit of that topic, and then I have some more follow-up questions about your profession. You raised a great point, the animal transmission to humans. Now take us through this COVID-19 and try to give us your way how it might have happened. What is your analysis of the origin of coronavirus?
So yeah, it's a very interesting question, and it's probably a long answer, but we do not know a lot of things about origin and things like that. What we know so far that our climate actually changed, the environment changed, and our human being expanded in this world and universe. So as we are doing this and as we are growing it, we became very destructive to our nature. So you can imagine that the microorganisms, they actually came millions and probably billions of years before human being. So they made their way to live on this universe for many 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 years
Yeah,
before us.
centuries before us. Yep.
Correct. So they know how to survive, and everybody knows how to survive, and they're much smarter than human being because they carry a lot less DNA structure than human being, but they can be much more destructive if they can. So the virus and the bacteria, they live in this on this earth. Some of them are good for us, some of them are not good for us. If you look at the past 35 to 40 years, actually, the zoonosis that we talk about, the virus that comes from the animal to human being, that actually is significantly higher than years before. Okay, we know about the plague and everything in the past, in the European nations got wiped out and everything, but the viral pandemic and epidemic, we have never seen anything like this actually before.
Yeah,
So
it's like a
there must be.
modern epidemic. It's like
Exactly.
something.
So
Yeah.
there must be something, and which is now scientists are thinking that, yeah, because of the climate change, we are actually destroying the jungles. We are destroying all this, rainforest. We are uh, like, every year, billions of animals got slaughtered,
Hmm.
for our, own
Survival
survival.
and use, yeah,
Yeah, for
using
our
up the
food and everything,
resources.
food industry. So uh, the virus, they live in animals, in birds and things like that. So when we are destructive to all this nature and the natural things, then these microorganism get their way of from the primary host to secondary host to the other host. So they mutate. They of course mutate all the time, and the mutation actually makes them to survive in a different host.
Hmm.
So it comes basically from the bat to intermediary host, like kind of animals. It can be pig or anything like that,
Yeah.
and then it makes its way to human. When it's jumped to human, then it becomes transmissible from human to human. Now, what is the origin of this coronavirus? Well, we know that the coronavirus has a lot of species. We know about the SARS, we know about the MERS. Those are all from different animals that we got. But this particular one, so far we know the patient started coming from the, Wuhan, the wet market. But there's some controversial, talk on this. What is the origin? Because now we can see that there was a patient was detected with the coronavirus COVID back in December in France. So we don't know what those patients, how did that patient get that virus? Was there any connection between China and that patient in France? So I think there is now a team who is actually looking into the origin of this virus. But those can be, complicated by all this political talk and things
Yeah.
like that. But the bottom line is that the virus, the zoonotic virus, is rising, and it starts from one animal category to another animal category and constantly mutate, eventually get their way to human being and then become pandemic. That's exactly happened with this COVID-19.
Very good. Thank you so much for sharing that information. I remember that when this was about to start and we were learning about it, you told me that the laboratories in China within 8 to 10 days were able to detect the DNA and create some information and share with the world. Do you think we would see that these kind of labs would happen more in other countries to quickly diagnose these diseases in future?
Yeah, so, one positive thing that I always tell people that, look at the perspective.
Yeah.
So when we had the last huge pandemic in 1918 to 1920, we did not even know that that was caused by a virus.
Yeah.
Yeah. So the virus, as you know, I mean, there was a hypothesis that in the, around 1890 or somewhere, one of the, tobacco plant was getting destroyed by something. People thought that it was bacteria, but it was not bacteria, much smaller than bacteria. So they thought it was a virus, some kind of, other microorganism. And then we got the Spanish flu during 1918 and 1920. 1935, we first saw the virus under the microscope. So you can imagine the science actually developed so much. We only know about the virus in 1935. After that, we have like thousands of viruses that we know now. And we did not even know that flu virus, then the, influenza virus was causing that pandemic at that time. Compared to now, the December 27, the first patient was admitted. By mid-January, we not only see the virus, we also know the fingerprinting and the DNA and RNA of that virus. We know how to diagnose it.
Yeah.
This is absolutely fascinating. This is something that science are, offering us right now. I think because of the social media and the 24 hours news and everything, our expectation is actually going in a point that it is really unrealistic. I think so far what we have gotten actually from the COVID-19 is developing so fast. It's unbelievable. Now we are talking about the vaccine, for example, and we think that, yeah, it's a miracle vaccine. Why there is no vaccine? Oh, come on. I mean, even influenza virus that we know every single year, we know what is this vaccine. It takes about a year to develop vaccine. So
right.
basically, when you talk about vaccine, it takes about 10, 15, 20 years. But this time, we are innovative way actually doing the RNA virus, which is completely different and very, very new. And that can actually produce a vaccine in a very short period of time. And we are very lucky that within few months, we already know the phase 1 trial data. We already know the phase 2 data. And in fact, this morning, I was looking at CNN, there is a breaking news that we now know that the phase 2 trial is not only safe, but it producing enough antibody to fight COVID-19. And we found that it has a neutralizing antibody. So that's very, very good news.
Very
we
promising.
have never seen anything like this.
I agree with you, and what you said exactly. And right from the beginning, when I met you and you were put into this role for as a leader for the entire enterprise and lead us into the protection mode, and your leadership and your thoughtfulness has helped us to keep our hospital, touchwood, COVID free. I think that right from the beginning you had an open-mindedness to this. And
Thank you.
recently somebody told me Winston Churchill had said one day, never let a good crisis go to waste. So I think what you're saying is that we should not let this coronavirus crisis go to waste. We should put together our wisdom to create better solutions for future. And be honest with you, we all need to be a little bit more careful of how we spread infections of any kind. You have been helping our hospital to control C. diff. We don't have cases, but look at other hospitals. There's so many cases of C. diff. So we as healthcare providers can do a better job in teaching others how not to spread infections, right?
Thank you, Farhan. I mean, I think you brought a very good point. And yeah, it's first of all, I'm not the one. It's a teamwork, as you know, that we have such a great stakeholder. We are blessed to have such a understanding and cooperative stakeholders that we all did it. Uh,
Yeah.
you're absolutely right. We need to bring something positive and good out of this COVID-19 crisis. I'm very, very positive about this one. I'm very excited because we've been talking about this hand hygiene and personal etiquette and all sorts of things for a long time. We've been struggling to get people attention to vaccination. Every single year, we do a lot of campaign very hard to get the flu vaccine. Right now, I'm just going to tell people, if there is a vaccine for coronavirus, please get it. Don't refuse. Okay. So, you know,
Yeah.
so that actually, it's playing a good role.
Yeah.
I'm sure that people are going to be, thinking twice before they refuse influenza vaccine. People are going to be much more concerned about their personal hygiene, etiquettes, the cough etiquette that we are talking about, all these things that, the distancing and everything. Just imagine, flu is killing 250,000 people every single year. We
Yeah.
we lose like thousands of people every single year. We never talk about hand hygiene. We never talk about the etiquette. I mean, we hardly follow these things. I mean, people with the flu is walking around and, is spreading. I think, and I'm very hopeful that this year we might see a lot less flu at least because
Yeah.
of all these things that we have learned.
Mash, I have to tell our audiences that in our hospital, since you are the infectious disease, um, uh, chief of infectious disease, we make sure that everybody's vaccinated. And I remember some of the stakeholders who refused to get vaccines, and they used to complain about you telling them to wear the mask from the season starts till the end. And I remember some of them, one of the stakeholder was working and I was friends with her. So one day to joke with her, her birthday came and I gave her a mask as a gift because she was not
Good for
wearing
you.
that. And people used to complain about it, but now look how people are accepting this, because I think that brings a good positive aspect of it. Of course, nobody wants to lose a loved one. That takes me to another last question about COVID-19. About I recently came across a friend of mine who is in a hospital with getting remdesivir, right?
Remdesivir, yeah.
Remdesivir. So what do you think of that? Is there a hope there with that drug?
Yeah, so there's some hope, but it's not that um, too much excitement. I would caution because
Okay.
the viral infection usually uh, don't have much therapy that can completely cure. So from flu, we know that we have a Tamiflu, but if you take a Tamiflu, your duration of the flu actually get less. It doesn't
Hmm.
necessarily cure your flu. Okay,
Okay.
so remdesivir is something that has antiviral property. It works at the polymerase level, which is very good, and it was tried in many other viral infection, which did not have much good outcome. But this one actually, the good thing is that remdesivir has been tried in a very good clinical trial and very methodical, very scientific, so you can trust the trial. So what we have right now, they tried in a moderate to severe patient, not patients at home. So we have to caution that this is not for everybody.
Yeah.
Because 80% of COVID-19 patients, they get better. So the patients who are really moderate to severely affected, they gave this remdesivir at one arm and that no remdesivir in another arm. So what they found, basically, people who took remdesivir, they were discharged at least 4 days earlier than if you didn't have the remdesivir. What does it tell us? That 4 days in the hospital is a big deal actually. In 4 days, a lot of complication can happen to you
Okay.
if you're admitted in the hospital. So getting out of hospital 4 days earlier is a big deal. Whether, you expect that to be a miracle drug, no, it's not a miracle drug. It's not gonna cure, like I said, but at least it reduced the, duration of your disease. And one other thing they found is also the mortality, which has a difference between the, control and the remdesivir, but they did not achieve a mortality rate which is clinically significant, or statistically significant rather. So I think they are still doing some other trial right now with another antiviral agent with the remdesivir, 2 together or 3 together, and see if we can further reduce the severity of the disease and the complication and things like that. But so far it is pretty safe drug. Unfortunately, it is not that available at this time.
Mash, thank you so much. I think we can go on a lot on COVID-19, but we'll reserve it for a later time. I want to come back to you. I've seen so much interest in COVID-19, and your role has become so much important in this institution. Is this your dream job? What would you call it, a dream job as a physician now, such a seasoned and experienced physician?
Well, I mean, like I said, when I chose my specialty, and I found my dream specialty, but not necessarily translates to your job. But I'll be honest with you. I mean, I was in academic. I was doing a lot of things. I gathered a lot of experience from tertiary care university setting. That made me very, very strong. So when I came to Cancer Treatment Centers of America, I had a lot of opportunity. It is in front of me, actually. I could apply all my experience that I gathered in a university setting and then build on it here and then start something here. So, like I said, when you have a job that you don't feel stress of coming and leaving, and people are nice and they're friendly and cooperative and they value you, they respect you, they love you, that's a dream job.
Wow.
I have my dream job.
You have your dream job. Amazing.
That's how I feel.
And I think you have always made that clear to everyone. My question is there any roadblocks that you see for any physician within our ecosystem or in United States overall that may apply to you or may not? What do you think that is?
Well, I mean, I think, the COVID-19 situation, this crisis actually taught us a lot, yeah. And actually opened our eyes. I hope, we are very proud of, developed countries and Western countries, and, we have a lot of innovation. Obviously, those are all true. We have made a lot of achievement in medicine, particularly in the United States of America. We do a lot of trial and a lot of science and everything. But this pandemic actually made us humble and made us, sort of sit back and think, are we there? Are we the great actually? When we are not really equipped of, tackling this kind of pandemic situation, we cannot actually provide the care that we are supposed to. We are not equipped with the PPE that we are supposed to. That makes you sad, actually. There's something wrong. So I think, all these countries who have resources, I'm not talking about the countries who don't have resources. They have lots of other problems than, PPE and things like that. But the countries who are very proud at some point, and, we know that we have everything, we are powerful. I think we have to sit back and see where our efforts and the energy and money should go, actually. If we cannot provide the basic healthcare to our citizens, I think we are failing. So this pandemic actually giving us the opportunity to open our eyes and see what we can do and what we shouldn't do. So rather than, fighting with each other and political game and everything, I think we need to focus on some of these infectious disease issues. For example, why our hospitals are actually struggling with the COVID-19 patient. Why we cannot have a specialized infectious disease hospital, or you can convert that any other hospital to infectious disease hospital, dedicated one, in every city in this crisis situation. So you don't have to struggle, you don't have to close the hospital, because right now, I'm actually really concerned about the patients who has disease other than COVID-19.
You're
We are
right.
canceling appointment, we are holding the appointment, we are not in touch with the patient, we're doing a telemedicine, which is great, but you need to get in touch with your patient. We are canceling surgeries, people suffering from blood pressure, diabetes, all kinds of things. So, they're afraid of coming to a regular hospital because they don't want to get exposed to COVID-19. The hospital healthcare worker are getting exposed to COVID-19. But why we don't have this kind of, infrastructure that you have, dedicated hospital which has plenty of PPE, the people are dedicated taking care of COVID-19, so we don't have to, under stress, and the patients can go to other hospital with peace of mind. So there are a lot of things that, that I'm thinking right now that we need to change. And I think this crisis will open our eyes.
Wow, and it's definitely tells me that one of my questions to my guests is, what makes you stronger or resilient? And from you, what I'm seeing is that this crisis is actually going to make us better and stronger as a nation, as a healthcare provider. We have to lead or give suggestions. What you just said, I'm gonna ask you, is that the reason you think that country like Germany has, I heard that they have created taxis, kind of healthcare taxis, where they go to people who have been tested positive and follow them, and if they're sick, they bring them without getting the rest of the world disrupted.
Yeah, so you can see that the pandemic, the model of tackling the pandemic, it's not something new. You don't have, we didn't have to learn this once it is already here.
Yeah.
You knew this how to say. The famous movie, that Contagion, or something like that.
Yeah.
Right? You probably have seen that.
Contagion,
So,
yeah.
if you look at that movie, every single thing that they showed over there, the social distancing, PPE, everything was there. So it's not new. We know how to tackle this.
Yeah.
We are not really get serious about it. So, for example, the only way you actually handle this situation is actually detecting, contact tracing, and the isolation, right? So back in January, when we had a first case, we should have been very, very, proactive, not reactive. And then, you start testing people, you isolate them right away and things like that. Guess what? We've been telling that, stay home, stay home. Well, you have one patient in your house and you're staying home with other family members, they're getting all this infected. This strategy is still not very very
foolproof.
scientific.
Yeah.
So there's some gap actually. And also this strategies is not really sensitive to the socioeconomic structure. So for example, you're telling all this social distancing and isolation, this may not work in a low-income group. People are really struggling to bring the food in the table, and they may get frustrated at some point that I don't have any work. What if I don't really care about this
How
thing.
can you be at home with the kids who don't have food and you can't buy them, and you be happy stuck at home and not be able to work? Thank you for these thoughtful words. I am going to convert our topics to more a little bit of a topic of work-life balance, and also maybe, I know there are a lot of things that you do that keep a work-life balance. Do you think, have you been able to achieve it? You can tell us the details in our section, but do you think you have a good life-work balance currently?
I think so. Yeah. not in the beginning of my career. I'm probably in the middle or a little bit further than middle of my career. So yes, I matured and I know how to tackle this, how to adjust your life with your professional life and everything. So yeah, I have made some promise with myself, and I made some strategies myself, and that's working for me.
Good. Okay. Thank you so much, Mash. It was a pleasure talking about your professional life and your pearls of wisdom for infectious diseases. That would conclude our professional session with you today. Thank you.